miles.
That's
huh?
right, I'll tell you.
All right, well, onto our house call now. There are approximately 100,000 Canadians living with multiple sclerosis. Many manage the disease with a strict medication regime.
Now, a new treatment option is giving new hope to Maritimers living with MS. We get the details in tonight's house call.
5 years ago, Dorothy Ann Brown was diagnosed with multiple sclerosis. The disease affects almost every aspect of her life.
For me, it's fatigue that wipes me out. The pain wipes me out. I have cognitive impairment, mild cognitive impairment, that makes it really hard for me to even do. I write, and I find it very difficult to do that.
Dorothy Ann tries to manage her illness the best she can through diet and exercise, but she also relies heavily on medications.
I take things like Copaxone, which is a disease-modifying drug. I take antispasmodics to stop the spasms in my legs. I did have a license for medical marijuana to stop spasms. And so there's a bunch of things that you can take to deal with your symptoms, but there really hasn't been anything that actually stopped the disease in its tracks.
Now, Maritimers living with MS have a new treatment option available. Recently, Health Canada approved a drug called Lemtrada. Dina Simon is president of the MS Society of Canada Atlantic Division. She says what sets the treatment apart from others is its unique dosing schedule.
So you have five treatments over the course of 5 days. Then you wait 12 months, and you have 3 more treatments. And then you're not supposed to have any more treatments for the balance of your life.
Lemtrada is delivered to patients intravenously in the hospital. Not everyone living with MS is a candidate for the treatment, only those with the relapsing remitting form of the disease. And like many powerful drugs, it can have very serious side effects.
With Lemtrada, we know that there can be kidney dysfunction, problem with platelets, problem with thyroid, and someone can have a very poor reaction to it as well.
Dorothy Ann says she is eager to try the new treatment. Unlike her current medications, which are covered by the province, Lemtrada comes with an estimated cost to the patient in the tens of thousands of dollars, well beyond her means. She hopes to see that change in the near future.
You just have to have the 2 treatments. It might end up costing less over the long term, so I'm hoping that the government will look at covering it, because as an investment, that's a good investment if it works.
The MS Society says it's pleased anytime a new therapy is introduced.
We always celebrate when we have a new treatment option because it gives people more flexibility and more control over their lives.
And that's good news for the more than 6,000 Maritimers living with MS.
That is good news indeed.
It certainly is. If you're living with MS and think you could be a candidate for this new treatment, be sure to talk to your doctor.
I would imagine.
Lemtrada.
Well,